Hello, good afternoon, everyone, and happy Youth Day. This is one more of our weekly Q&As with Dr. Mike Ryan and Dr. Maria van Kerkhove. As today is Youth Day, we will be focusing on responding questions about COVID-19 and young people. You can watch us today on TikTok, hopefully Instagram, Facebook, TikTok, LinkedIn, and YouTube. We've had some technical issues here behind the scenes, so apologies for delay in timing. Maria, Mike, as we celebrate today Youth Day with the theme Youth Engagement for Global Action, what is our message to young people today and how they can be part of the solution to the COVID-19 pandemic?
Thanks, Alex. Thanks for having us, and I hope all the platforms are working. So I think our message is simple. It's get yourselves involved and keep yourself safe, and you have a role to play in this pandemic. I think it's important that everybody feels that they have a role to play, that everybody needs to be part of this fight against this pandemic, no matter how old you are, no matter where you live, no matter what type of situation you are in. There are actions that you can do to keep yourself safe and to keep your loved ones safe.
Thank you, Maria. Dr. Mike, do you have a message for young people today on Youth Day?
I have a message for a very special young person. It's my son, Tom, is 15 years old today.
Oh,
it's his
happy birthday.
So happy birthday, Tom. And a fine youth he is. And in reflecting on I just think that young people, young adults, they're the engine of society's ideas. They're the engine of innovation. They don't believe any idea is crazy. They're willing to try anything once. And so I think we need to leverage and sort of amplify the creativity of youth and be very careful. We've seen some of the rhetoric in the last number of days, sort of, oh, it's young people's fault. It's nobody's fault. The pandemic is not the fault of young people. It's not the fault of old people. It's a virus that's spreading in our society. And once it can enter and establish itself in any geographic area or in any age group, it represents a threat to all areas and all age groups. So we all need to play our part, as Maria said. But I think young people need to, as Maria said, engage, become part of the solution, drive the solution. I said it here before. I think future is in the hands of the youth. It's your world, and you need to get on with taking control of this virus, just as we're trying.
Thank you both. I would invite all viewers, and especially those who celebrate Youth Day, to ask their questions. If you're watching us on Twitter, use hashtag AskWHO. On other platforms, please leave your questions via comments section. You both mentioned that we want young people engage in this response, but what do you think, where do we need the help from young people the most in this response?
I mean, I think there's a number of things that young people can do specifically. First of all, for keeping themselves safe. So there's a number of actions that everybody can do to prevent themselves from being exposed to the virus, and prevent themselves from getting infected, and prevent themselves from passing it to somebody else. And these are the basics, you know, in terms of washing your hands, making sure your hands are clean, washing them or using an alcohol-based rub many times per day, making sure that you practice physical distancing. And again, we say physical distancing and not social distancing because we want you to stay physically distant from someone, at least 1 meter apart, but remain socially connected. It is so important that we stay socially connected with our loved one and our friends, because it's very, very difficult to be separated from our family and friends. Make sure that you avoid crowded places. Right now, this virus really likes crowds, and it can spread between people in crowds. So if you can avoid those right now, that's important. And if you're asked to do something like stay at home, please stay at home. You know, if you're asked to wear a mask, please wear a mask. But I think also one of the things that we need young people's help with is through this social net that we live in, and passing good information around. There's so many different platforms that information is spreading. Make sure that information is accurate. Make sure that it is not myths, so it's not disinformation, and that it won't harm people, and pass good information around. And then lastly, just a plea to young people to help the older people in your family get themselves set up on with technology. And I say this as someone who's had to help my own parents, set up FaceTime and Zoom and all those different things. Be patient with your family members. Help them set up these different types of platforms so that they can stay connected. I know many grandparents are isolated and feeling quite isolated. So there's different ways that you can make them still feel connected, and give them a call, check in on them. And we've been so overwhelmed by the amazing acts of kindness of young people in everyday life. I mentioned before my son drawing rainbows for all of us, or people just checking in on their neighbors, picking up groceries, doing things that are safe, but just, looking out for one another.
Thank you, Maria. We are already starting to receive questions from our viewers, and someone watching us on Twitter is asking, how can kids be more involved in fighting COVID?
You want me to take? You take?
Yeah,
I have kids.
You have kids.
You've got some pretty
have
cool
kids.
kids.
I've got some pretty cool kids, yeah. Well, again, doing all of the steps that they can do in washing their hands and physical distancing. The other thing that they can do and get involved in is volunteer. They can volunteer to help, even if it's just within your own home, helping out around the house, helping out around their neighborhood of people that maybe need some help, checking in on them, running some errands for them, of course, if it's safe. Another thing they can do is donate, and they can raise money. And I'll mention my own niece, who raised almost $1,300 by making barrettes out of ribbons. And she raised $1,298, my niece Emma, and she donated it to the Solidarity Fund to help us do all of the work that we do and help countries. And we're seeing lots of young people come up with innovative ways to raise money. And then the last thing I would say is to help us be creative in the solutions of what our new normal looks like. This is a difficult time. It's a challenging time for all of us. And we're all sort of figuring out what our new normal looks like. And we're going to be dealing with this virus for some time. But we need your ideas. We need you to help us be creative about keeping connected and keeping ourselves learning and all of that. And so we look forward to that creativity and innovation and helping us to find a new way forward.
Absolutely. And I think just also, and I know this may sound a little crass, but I think there's an optimism about young people and hope. And it's tough on older adults and older people. I know in the case of some of the older people in my life, they feel in many ways they have limited time. A year is a huge part of the rest of their lives, and they're losing that year. And it causes a lot of that isolation and that. And I think there's nothing more infectious than the hope of youth. There's nothing that enlivens and creates that energy in community or in a household than young people and just doing what they do. And I just think that joy and that enthusiasm for life is what we need now, and that hope and just being kind and not participating in the negative stuff. It's a time for kindness. People are tired, people are isolated, people are nervous, people are unsure. Everyone's a little bit more tense than they were before. And it's amazing just how a kind word, ask people how they're doing, just ask people how they're feeling, and more empathy with other people in your own house, in your own community, in your school. And know that there are others who may be in a much more difficult situation than you, and there are people who are isolated by maybe they're migrants, maybe they've got other situations in their life. They're already isolated, they're already feeling excluded, and then COVID-19 has created more isolation. So it's even more important for that to be the case. And Maria was talking about volunteering as well. We've seen medical students and student nurses go in essentially into the front lines. We've seen a lot of college students volunteer to become contact tracers. So it depends what age group you're in, but there's a lot of younger adults who have qualifications and don't necessarily have access to jobs right now, and there's lots that can be done in volunteering. In fact, we could do with a few interns over here if anyone is interested in working 22 hours a day. Send your CV. But I think for everybody, and as I said, there's nothing that lights up the life of an older person in our society than a visit from a young person, a phone call, Facebook, text, and maybe if everyone who's looking at this right now could just right now stop, send a text message to some person that they think needs to just contact.
Yeah.
We could make a difference right now.
Yep.
If everyone just did that. And I think that is very important, and it's not to be underestimated. We all get through crisis through solidarity. It's not just in the movies, not just the way it works. You stick together, you get through things together, and this is a time when we do that. And no one better than young people to bring that joy and that sense of community to life.
You know, Alec, just to say, we're all in this together, you know, and it's not just an adult problem that we're having here, it's all of us that are dealing with this. And I think a lot of young people, this is impacting young people, and we recognize that, and everybody recognizes that, and this is tough. This is tough, and I think one of the things we need to do for young people is listen. Not just talk to, not just talk about, but listen to. So I do hope you're getting some questions from young people, because we need to hear, we need to listen, we need to engage, and we need their voice. We need your voice as part of the discussion, as part of the solution, as part of the way forward. And that will make us all better. It will make the response better. It will make the future better. So don't be shy. Good ideas, bold ideas need to be heard, and they don't come from people who are shy. So speak up, you know, hold us all accountable, push us further, and work. And we all are in this together.
Thank you both. I just want to mention that a viewer on Periscope was leaving the comment, help them understand that these steps help protect their friends and the people they love. So I think you actually were responding at the time we were receiving this comment, so I just wanted to acknowledge a viewer. So here is one question coming from LinkedIn. Many young and lonely people are facing anxiety and depression when struggling with quarantine and other aspects of COVID-19. What recommendation and guidelines does the WHO provide?
This is a great question. One of the things we recommend is to keep a routine. So it is very important that, you know, every day when you get up, you have a routine. You have your breakfast, you take your shower, you get dressed, you have the activities that you should do every day. And having that routine is quite helpful. I know many people, especially, you know, people working here who started teleworking. There were lots of people who stayed in their pajamas a little bit, which we used to tease, but that's understandable. But getting in that routine of getting up and getting active is important. The other thing is to try to limit, it's important to have some screen time and to have some ways of connecting with people, but to limit that screen time to not all day, not too much. Make sure that you have some actual interactions with people. Try to avoid sources of news that may cause anxiety, because there's a lot of information out there. A lot of it is quite scary. Some of it is wrong. Some of it is very, very good. Keep yourself informed, but try not to overdo it. And I think do things that make you happy every day. So this pandemic is scary. This pandemic causes anxiety, but it does not stop us from listening to music or reading a book or laughing or talking with loved ones. Find the things that make you happy every day and make sure that you carve out a little bit of time to do that. And it's okay. It's okay to laugh, and it's okay to have a little bit of fun in going through something like that. But make that time for yourself.
Or even finding ways to be active.
Exactly, yep.
There was a story that we read recently about two girls in Italy while they were on quarantine. They were playing tennis from rooftops in their terraces. So it was a beautiful, beautiful story. There are some questions coming as well about the effects of this pandemic on young people. Besides mental health and anxiety, what are the other consequences that we can notice on young people?
So the first thing is that all people can be infected with this virus. We know that, whatever age group they are. What the data is telling us so far is that the majority of younger people who are infected tend to have a more mild disease. But that's not always the case. So we do know that young people and children can develop severe disease, and we do know that some young people, some children die. And so it isn't universal. We are not invincible to this. Young people are not invincible to this. The other thing is that if you are infected, no matter what age you are, you can pass it to somebody else. So not only is it important to prevent yourself from getting infected and developing a disease, but you have a responsibility and some power here to prevent infecting somebody else. And you could prevent infecting somebody else who's part of a vulnerable group who are at a higher risk of developing severe disease and death. We're learning quite a lot about what mild disease means and what mild disease looks like, and the recovery of some people. We're starting to learn that there are some individuals who, even though they had what would be considered a mild disease and not really needing hospitalization, are having some long-term effects of difficulty breathing. They're not able to get back up to exercising the way that they would like. They're having fatigue. We don't completely know the disease profile yet. I know this pandemic feels like we've been in it for an incredibly long time, but it's still new, and we're still learning it all the time. So it is important that you do everything you can to protect yourself, but do what you can to protect your mom and your grandma and your aunts and your loved ones, because it is a responsibility that all of us have. And again, we just want everyone, and especially young people, to feel empowered. You have control, you have hope, there's a lot that you can do. There's a lot that we can all do.
Thank you, Maria. There are, besides effects that are happening now with the virus affecting all of us, including young people, there are some also long-term effects in terms of education and job opportunities. Can we comment on this as well?
Yeah, no, I think this has been the greatest shutdown in education in history, in terms of days and hours lost in formal education. And it's a great credit to the schools and the teachers and the students who've managed to keep going with virtual education, but that has not been possible for everyone. So clearly there's a lot of catching up to do on the education side. That's for sure. And again, the economic losses will go on, in the sense that there will be an after effect. And it's tough enough. I mean, if I'm a young person now coming out of college, it's already tough enough to get a job, get an internship, no job, no experience, no job. So even getting experience when everything is shut down. So it is an extra worry, and things are going to recover. We hope they'll recover more quickly than slowly, but it's an extra strain on particularly on younger people, because while our lives, I think, over the last half century have become in general more prosperous, they've become more uncertain in that sense. There's no guarantee of a job, there's no guarantee of an income. It's the top 1% may live in luxury, but for most ordinary people, it's about getting a job, getting on in life, and there's that degree of uncertainty, and there are no jobs for life. So there's a lot of uncertainties out there, but and COVID and the disruption that COVID has caused is a negative thing. On the positive side, I think there's great hope. I don't know, maybe I'm wrong, but I sense a new energy for a different way of living. And I think this is where young people really have the power to change things. Is this the world we want? We want a world where we're constantly worried about jobs, worried about our incomes, worried about paying our debts, constantly trying to gather wealth, constantly trying to get into that top 1% while many others fall into poverty. A world in which we exploit the planet, we exploit other human beings in order to get ahead, and to use that terrible term. Or do we see a future that's a bit more balanced, where life and love and community are a bit more balanced, where our relationship with nature and the planet is a bit more sustainable, and where maybe we don't have to strive so hard for attainment and wealth, but where we can learn and grow more together as a society. And I get a sense, maybe, as I said, maybe I'm wrong, but I get a sense that young people don't want the world we're giving them. They want something different, and I think they want something a whole lot better. And I wish to God we could give it to them. But I think maybe the young people are going to have to take it themselves and demand. And this is where I think, young people and youth are not helpless. You need to get political. You need to get out there. You need to stop looking at the world of politics as the world of adults, and start learning that the world of activism and politics is your world, and that will define the future. And we need young leaders to step forward and represent you and represent the future, because I'm not without hope. I think we're going through a tough time, but sometimes in the darkest of times is when we see the light, huh? So hopefully, inshallah, we will find a better way.
Yeah, Alex, sorry, just to say one thing, there was the Director General held a webinar today with youth, and one of the things he said, touching on what Mike just said, was we need to give young people a larger role in political decision making. And you know, more than half of the world's population is under 35 years old. So there's a voice that is there that represents a huge proportion of this planet. And getting involved in voting and getting involved in activism and getting involved in speaking up and speaking out and being constructive and collaborative, and this is what we need. And I agree wholeheartedly that we can make a better world, and we do this together, but we need the leadership from young people and young adults. And you know, we're receptive, and we are all receptive. So please use that voice. You know, use it wisely, and speak up and speak out.
Thank you, Maria. Thank you, Mike. Here are some questions related to virus that are coming from our viewers. Why coronavirus keep erupting after it has shown lesser cases in the nations who made good progress?
Why does it keep resurging?
Yes.
So that's a very good question. So what you're referring to, and thank you for this question, is that this virus is still circulating in many countries. And what we have outlined as the World Health Organization are the actions that need to be taken to bring transmission under control. We call this breaking chains of transmission. We don't allow the virus to pass between people. And there's a number of actions that many, many countries are doing, and they're being successful at that. If the virus has an opportunity to interact with people in these crowded spaces, for example, the virus will resurge. So in many countries right now, we're seeing these isolated pockets of clusters and these cases. Some of the clusters are actually associated with younger people. This is not to blame the younger people, but this is just to acknowledge that they are happening in places like nightclubs, and they are happening in places like bars. But this is reflective of being in closed spaces, in close contact with one another, sometimes in areas where they have poor ventilation. The virus really likes that, and the virus can spread. And so if we allow this virus to circulate, it will. So there's a lot of things that governments need to do, that communities need to do, that individuals need to do to be ready and to act very quickly when the virus is identified, so that we could break those chains of transmission and prevent these clusters of cases to becoming community transmission.
Thank you, Maria. Here is a great question coming from Aida. How can youth get involved in WHO programs?
Lots of ways. Yes, we have volunteer programs, we have internship programs, we have a junior professional program with many different countries like Korea, Japan, I think, Netherlands, and a few others. So there are arrangements with certain countries where we have a formal junior professional. The internship program was wide open, and in fact Dr. Tedros, which I thought was a great initiative, because coming to Geneva as an intern may sound great until you see what it costs to live somewhere like this.
Yeah.
And for many years, you know, interns could come, but they couldn't support themselves. So you can imagine the interns would have come from a different set of countries, and Dr. Tedros has instituted a system of subsidies so that interns can come from all over the world and experience time here. I don't know where the cycle of the program is now. And we have a WHO volunteer program. We love when people do pro bono work for us. We're very happy to work with people. We have a lot of people who work on $1 contracts.
I did for 8 years.
Maria did for 8 years as a scientist with Institut Pasteur and with London
Imperial
College.
Yeah.
Yeah. So we have a huge amount of collaborators out there. So if anyone has any ideas, maybe we need an army of youth to work. We've got the EpiWin project in terms of fighting infodemics and fighting, and you got the social media team here, Alex, and the whole lot. I mean, I'm sure you'd like a few extra pairs of hands. So the age profile in the media team is very young now. So yeah, I think it's a good. I think we could. We also have 147 country offices, and certainly, I'm sure they would always like assistance. So yes, we could look at pointing people in the direction. And there are other volunteer programs. UNICEF is a volunteer program, Red Cross is a volunteer program, so it doesn't have to be WHO. There are some brilliant NGOs out there. And remember, in your own places, in your own cities, You know, you have NGO, non-government organizations and charities who work with homeless people, who work with people with mental health disorders, who work with older people, and get out there and volunteer and do something. There is nothing more gratifying than giving your time to a cause, and it pays back immeasurably. So, and if there are any budding stars out there, we can try and steal them for WHO. Huh?
I met one, and when I did the UNICEF, the world's largest lesson, who was telling us, you know, thinking of ways to look forward and how is this pandemic going to change the way we do preparedness and how we look, and great ideas. But it's also a good idea. It's also a way to get experience. So I have a lot of people that come to me sometimes, especially interns, that come and say, how did you get the job you have, and what was your plan? And a lot of the time, to get started, it's hard to have that experience. So volunteering is a great way to get some experience and some practical experience, and learn what you like, learn what you don't like. Learning what you don't like to do is also just as important as learning what you like, and meeting people and networking and meeting as many people as you can. So lots of opportunities to work with us and other agencies.
I would love to have an army of young people supporting us on social media, but I just want to mention that I've been with WHO over 5 years, and I started as an intern. And if I wasn't a student in Geneva already, it would be impossible. So this is a great progress that I've seen as well since I've been here, that we have more people coming from developing countries to support us and to gain experience with WHO and UN. There is a very interesting question coming from younger viewers here. Is it safe to be intimate with their partners during COVID? And because we are suggesting physical distancing, so how young partners can stay safe but still stay together in a way with their partners?
Yes, so this is a virus, it's a respiratory virus that passes through droplets and contact with a confirmed case. So if you have somebody that is a confirmed case, if your partner is a confirmed case or a suspect case, it's important to stay apart. And it's important to stay apart for a certain amount of time, get themselves tested, make sure that if they know that they're infected or not. So our recommendation is, if there is a case, that you isolate the case, that the case themselves is isolated. And if you are a contact of that case, then you become quarantined yourself. So any contact there is important not to have. But if no one is a contact, then there's ways that you could be safe with your partner. The normal ways to be safe with your partner.
Yeah, I think the risk here is not intimacy. The risk is proximity.
Yeah.
So if for the reasons of COVID you need to be far apart, then intimacy is not possible. And if it's okay to be close together, then have fun. I think it's a matter of being careful with respect to the health of others. And if the local rules are, and it's particularly true, I think, of people in younger relationships where they'll live at home and they meet outside. For people who live in apartments, if you're living with your partner, then you're either going to be quarantined or not, or you're going to be together or not. I think the tough thing has been, in these lockdowns, boyfriends, girlfriends, boyfriends and boyfriends, girlfriends and girlfriends are sort of been stuck on different parts of a city for 15 weeks, and they can't go to each other's houses because of the rules, and that's been quite tough on people. So I think as things ease and people can move and meet in groups again, that's fine. So I think you really just have to follow the local rules. But as I say, it's not about intimacy, it's about proximity. If you shouldn't be close to someone, don't be close.
Thank you very much. I'm afraid that we're running out of time, that Dr. Mike needs to join another important commitment. We thank everyone for your...
Could I just, before you finish,
please,
just one thing, because I think it's important in terms of getting our messages right amongst ourselves. I think each and every young person needs to look at the different encounters they have, the frequency, the intensity and the duration. You get to choose at some level. You choose whether you go to the gym or not. You choose whether you go to the nightclub. You choose how often you go. You choose how long you stay there. And you choose whether you're comfortable being there depending on how many people are there. And you make those choices. So think about the context. Think about the places you're prepared to go and not go. Think about how often you do that. Think about how long you're prepared to spend in that environment. And think about what activities you carry out in that environment. And it's very interesting that it's really the crowded spaces The Japanese colleagues have a 3Cs approach. I think it's really nice. They talk about crowded spaces, crowded places, and close contact situations, and trying to avoid those. And if you can't avoid them for any reason, then you really should think about what can I do in this. I get on the train and all of a sudden 50 people get on the train with me. Well, what can I do in that situation? And in those situations, you should really be minimizing your activity, minimizing conversation, open a window, and wear a mask or step off. So even in those situations, there are things you can do. So just think your way through things. If it doesn't feel safe, it's not safe for you. And please be aware of what's going on in your area. If you're in an area that has very little COVID disease, then you don't have to be as aware or hyper alert. But if you live in an area with a lot of community transmission, then there are many opportunities for you to be exposed. You just need to be a little bit more alert. You don't have to rule your life by this thing. Just be smart.
Yep.
Think your way through things and make good decisions. Just try to make good decisions. And in the end, life is a risk. We cannot reduce risk to zero. And if you're young, that's not, life is too much fun to be thinking about risk all the time and having people waving our fingers and saying, please don't do that and don't do this. It's not good for us to be doing that, and certainly young people don't want to hear that, but you do have a responsibility too.
I just wanted to say also, your life matters, you matter, your actions matter. And so that's why we're so passionate about what we say and making good decisions and not scolding, but just saying you have power. Many people across the world can take decisions and limit your exposure where needed. Not stop your life, but really take the right risks and not put yourself at risk. Think of yourself and how you can protect yourself. But it isn't just about you, it's about your responsibility for others. So you're protecting yourself and you're protecting others. Think about your moms and your dads and your grandmas and your aunts and your uncles and your friends, and we are all in this together. But you matter, your voice matters, your life matters. So take these decisions as if your life depends on it, because it does.
I thank you very much both for your time today. I thank all our viewers for their great questions. We apologize once again.